Have a good day, friends. As you know that we all are participating in the 12-week certificate course on palliative care with integrative approach. And the aim of this course is to train the people, especially the volunteer level workforce, who can give the palliative care to the patient, and when needed, they can connect the patient to the palliative care team, which includes doctor on the top, the nurses, the psychologist, then family members. So you should be trained, you should be knowledgeable to know what is the condition of the patient and when to contact which person. Because most of the time, the palliative care patients are having chronic diseases, multi-morbidity. So you need a nephrologist, you need a cardiologist, you need a nutritionist. So depending on that, it is not the one doctor. One doctor for palliative care, that is okay. But for the complications, for the management of chronic diseases, you have to contact many people in the team. So most of the time in the chronic diseases or the old age, especially elderly patient under palliative care, the gastrointestinal system is disturbed. And the causes are many, there are multi-factor causes. First is the drug side effect. The treatment which is being given to patient for pain management, for this disease management, that creates the side effect. And second, the stress. Third issue is the mainly diet. So diet, mental stress, and side effect of the drugs. The three things upset the gastrointestinal system of the patient. And that weakens the person, number one. It makes him uncomfortable, number two. And it also compromises with the nutritional value. So the patient keeps on becoming weaker and weaker, which is not good for his health. So I'm going to talk what kind of diseases are basically found in this kind of patients. So first of all, GI symptoms are common in palliative care patients, very common. And symptoms like nausea, vomiting, constipation, diarrhea are significantly impact the quality of life. Constipation and diarrhea. Somebody can have constipation, somebody may have diarrhea. Or the same person may have sometimes constipation, sometimes diarrhea. And nausea and vomiting, because of the indigestion of the food, because of the side effect of the drug, liking and disliking, this is also very common. The integrative management using conventional medicine, Ayurveda, homeopathy, yoga, and naturopathy can be very effectively helpful in such patients. So first of all of you must note down what are the common GI symptoms which are found in patients of palliative care. Most common is the nausea and vomiting. Second is the constipation. Third is the diarrhea. Fourth is the acid reflux. Fifth, the peptic ulcer diseases. Peptic ulcer, also very common. Irritable bowel syndrome, IBS. It is linked to the stress. Your brain and intestine both are disturbed, resulting to IBS. Inflammatory bowel disease, IBD, and intestinal obstruction. So these are the common GI symptoms which is found in the patient of the palliative care. Now coming to one by one, I am introducing you in this slide, and after that, for each topic, I have planned a separate lecture for you. So this is an introductory lecture. I am covering the overall view of GI problems in patients, and after that, we will have one lecture for each symptom. Okay? So nausea and vomiting, the medication, opiates, and the chemotherapy, metabolic imbalances, and anxiety. They are the main causes. Its management is conventional, anti-emetic drugs. In Ayurveda, we use ginger, Yeshtimadhu, Satauri like preparations. In homeopathy, we use some Nux Vamika 30 and Ipeca 30C, and yoga and naturopathy, acupressure at P6 point, deep breathing. These are the recommended method to control nausea. Now, coming to constipation. What is constipation? Constipation is the problem in stool. Your bowel becomes constipated, it does not come out easily, and this creates a lot of problems. So, what are the causes? Opiates, low fiber intake, dehydration, and immobility. Because most of the time the patient is immobilized in this case of chronic diseases and end of the life stage, and he is not drinking much water, not liquid. The dehydration is also possible, and low fiber intake. Food is having low fiber food, and the use of opiates for the pain management. These are the four main causes which causes constipation. Management is laxatives. They use laxatives. It may be Ayurvedic laxative, it may be allopathic laxative, but this is very important. In Ayurveda, they use Triphala, isofgol, castor oil. They are using homeopathy, Alumina 30C, Bryonia alba 30C. In naturopathy, Vajrasan, Pavan Muktasan, warm ghee with milk. Of course, if they are not very resistant to sugar, then warm ghee with milk and sugar can be more effective for management of constipation. Diarrhea is very another problem in which the inconsistent stool passing is there. The patient goes to the bathroom several times, 5 to 7 times, maybe more, and that makes him very irritating, number one. And the low nutritional absorption, nutrition loss is the whatever he is eating, it is not being absorbed, it is going in the stool, and this is another problem. So diarrhea is more difficult to manage. Most of the time it is because of infection. Secondly, the chemotherapy, the drug which is going on, and malabsorption is one common factor in diarrhea. Malabsorption means the food which you are eating, which is being digested but not being absorbed, which is not reaching into the blood, it is not going into the liver for metabolism, it is not going to the body for nourishment. So malabsorption is a great problem. And bile acid diarrhea. Sometimes bile acid production from the liver goes high, that also produces diarrhea. You know, the bile acid is produced to digest the fat. You are eating fat, protein, carbohydrate, vitamins and minerals. So carbohydrate is fine, but fat digestion and absorption needs bile acid. And bile acid is secreted from the liver. If that is not normal, if it is low, the digestion will be low. If it is high, this is also a bad thing, that is the bile acid diarrhea. So anything can happen. The management, first of all, remember, you should know the trigger. I have shown you all the slides. What is the trigger? If you control the trigger, then things will be normalized. For example, in the constipation, low fiber intake is the trigger, dehydration is the trigger, immobility is the trigger. So try to avoid. In Ayurveda, they say, remove the cause of the disease. Disease will start curing itself. So what we have to do? So do like this. Similarly, here we are saying malabsorption is there, the bile acid overproduction is there, chemotherapy drug are there. You cannot remove it, but you know that the diarrhea is because of chemotherapy. So the day you will have chemotherapy, there will be more diarrhea. But they have a gap, they have a cycle of chemotherapy. In 2-3 days it will be controlled. But in that 2-3 days, how to manage the patient? That is your duty, that is your goal. Because chemotherapy has been given one day, and sometime, maybe 4 to 5 days, it will be over, and man will become normal. So you should not be panicked. You know it is because of the chemotherapy. In that situation, you should have some symptomatic management. And infection, if infection is there, then definitely antibiotic has to be added. But an antibiotic has a double-edged sword. It treats the patient at one time and also disturbs the microbiome. With the intestinal, good bacteria also get destroyed. So you have to be very careful, very choosy in deciding when to use antibiotic and when not. Management, conventional management, these are the medicines which are given to control diarrhea. In infection, if it is a protozoal, we give flagyl. If it is a bacterial, we give Bactrim DS like this thing. And now many advanced drugs have come. So leperodamide is thought is a medicine name. In Ayurveda, bilv. Bilv, you know, bilv means with the बेल बेल इज फल जिसका हम लोग खाते हैं. What is English name? I don't remember. Kutaj is a medicinal plant. Its bark is used. Musta is another medicinal plant. These things are very effective in controlling the diarrhea. And in homeopathy, arsenicum album 30C, podophyllum 30C, they are the given. Yoga and naturopathy, balasan, buttermilk with roasted cumin. Okay. Now we are talking about acid reflux. You know why acid is produced? Very interesting, you should know on the whole digestive system. When you eat your food, the carbohydrate start digestion in the saliva. Ptyalin is enzyme which digests the polysaccharide. Then it goes from esophagus to the stomach. The stomach is the place where protein is digested. Pepsin is produced, and it is a acidic pH acting enzyme. So in the stomach there is acid, but the moment it goes to the duodenum and small intestine, there is a alkaline, trypsin and chymotrypsin. These enzymes, they are also the protein digesting enzyme, but they act on the alkaline, in the alkaline pH. But pepsin work in the acidic pH. In the stomach, there HCl is also produced. This is important for protein digestion. But if it is produced more than normal, then you get acid reflux, which is not good. And this is very cumbersome position for any person to take care. Weak esophageal sphincter, high acid secretion. I am talking about high acid secretion. This is, and obesity. These are the main causes. The esophageal sphincter means the esophagus from here to here, and stomach. There is a valve. It doesn't allow acid to come up, but when it becomes weak, then acid from the stomach, which was produced for protein digestion, it starts coming up in the esophagus. It comes up to your mouth. Very, very painful situation. So how to control it? Conventional proton pump inhibitor, the H2 blockers, they are given, medicines are there. And Ayurveda, Madhu, Amalki and Satavari are given. Homeopathy, Carbo Veg 30C, Nitrum Phosphate 6X, and Yoga and Naturopathy, avoid heavy meals at night and Smith's pose. So these are some recommendations. We will come in more detail, we will talk on this topic. Peptic ulcer. What is peptic ulcer? There is a kind of H. pylori infection in the stomach and use of non-steroidal anti-inflammatory overdosing. You know, for the pain management, there are different kind of medicines are given. First, we give the non-steroidal like the Brufen. Brufen is the non-steroidal anti-inflammatory drug. COX-2 inhibitors we give. If it is not controlled, we give corticosteroids for the swelling and pain. If it is not controlled, then ultimately we give the morphine. So morphine is the last drug which is given for pain management. If the pain is not controlled by any drug, by any method, we give this thing. So but peptic ulcer is produced by this drug. We are giving it for the pain management, but at the same time, the side effect of this drug is the peptic ulcer production. We have to be very careful. That's why we say कि खाली पेट कोई दवा मत खाइए. क्यों मत खाइए? क्योंकि वो अल्सर प्रोड्यूस कर सकता है. The NSAID is one of those drugs which should not be eaten empty stomach. After some food, some breakfast, so it should be taken. And another is the H. pylori infection. This is another thing which is not related to NSAID like mechanism. This infection produces ulcer there is in the stomach. And stress, mental stress is another important factor which causes the peptic ulcer. So its management, if you know what is the cause, you can remove it, number one. If you don't know, then antacids as a symptomatic relief, PPI, and antibiotics. Antibiotics, this one, and Ayurvedic Yeri Esti Madhu Satavari and Doob. You know, this is a grass, Durva grass. It's a chutney is very effective for managing. In homeopathy, cold milk is also very effective in managing peptic ulcer. If you can digest milk, so cold milk, frozen milk from empty stomach in the morning is very effective in controlling the peptic ulcer and also the acid reflux. Both are the interrelated to each other. And yoga and naturopathy, meditation for the stress management, and avoiding spicy and fried food for this, because they are the cause. Because if these things induce more acid, if more acid is produced, there is a chance of peptic ulcer. IBS is very common and very difficult to manage. Most of the time, you know, if we are having a diarrhea, so we understand there is either protozoal infection or bacterial infection. We give a drug for you to treat it. But in that case, what happens? IBS is not related to infection. It is related to your brain and hypermotility or hypomotility of your small intestine. And this motility is governed by your stress level. So we manage the stress to control the IBS. It's the indirect control of intestine. So how to do it? The stress is the first cause. And gut dysbiosis, microbiome, I told you, intestine is having millions of good bacteria, which is good for the health. If that is disturbed, and how it is disturbed? Your food quality, food habits, and your mental stress both disturb the gut microbiome. This is called the gut dysbiosis. And food intolerance. Some people have lactose intolerance, very common. So food intolerance is also one factor for IBS. If you know that this food is inducing diarrhea or constipation because of IBS, you should not take that food. Very simple. If the gut dysbiosis is there, try to maintain this by using prebiotic and probiotic. And stress, if it is there, manage the stress, either by yogic practice and meditation, or by Medharasayana, Ayurvedic drugs, or by anti-anxiety drugs, allopathy. Anything you do, these are the causes you have to control. So conventional is the anti-spasmodic drug, which is directly acting on the stomach and the intestine. Probiotic, maintaining the gut dysbiosis, and dietary modifications. If any intolerance is there, this will help. So these are the things, these are the causes, and these are the method. In Ayurveda, we have a holistic approach like Triphala, Bilva, and Pippali. And homeopathy is the Lycopodium 30C. It acts on the stress level, and Chlorosynthesis 30C. Yoga and naturopathy, here are the peppermint tea is very effective as a diet supplement, and Pavan Muktasana is very effective. And IBD, this is autoimmune disease. This is caused by this thing, but autoimmune disease is difficult to manage because your cell itself starts killing your own cell. Basically, you have a defense mechanism in your body that protects your body against infection. They are supposed to, even cancer. Cancer is a foreign tissue. It should not grow. So your immune system should kill it. But when the immune system stops killing these cancer cells, or then they grow. But in some conditions, your own cell is killed by your own defense mechanism. They're autoimmune. And this can happen anywhere. Suppose in the leukoderma, what happens? This skin makes this melanin, this pigment. We have the brown color, and the synthesis of this is done by a cell, and that cell is being killed by your own. You get leukoderma. In the rheumatoid arthritis, what happens? The cells which make synovial fluid, they are being killed by your own cell. Similarly, in this IBD, the autoimmune response is disturbed, and chronic inflammation, the two causes are there. So conventionally, the immunosuppressant drugs are given, but it has a great side effect. The immunosuppressant drug will allow more infection to come, which is not good. You have to be very careful when you are using immunosuppressant drug. As using antibiotic, you disturb the microbiome. Similarly, the immunosuppressant drug, if you are using, you are more prone to infection, because those cells which were meant to protect you from infection, they are suppressed by this drug. So this is side effect. And corticosteroids, they are also given. This is the life-saving drug. And in Ayurveda, the same thing, Kutaj, Nagkesar, and Takra. Takra means buttermilk. Buttermilk is very effective in this. In homeopathy, mercurius, corrosium 30C, phosphorus 30C is given. Then gentle stretching, buttermilk therapy. Buttermilk therapy, the same thing. Tak and buttermilk, same thing. This is given. So intestinal obstruction, this is the last symptom which you get. Some kind of obstruction you find in the intestinal passage. It may be in the small intestine, it may be in the large intestine. It doesn't allow the bowel to move from your stomach to intestine to your anal part for going out. So it may be a tumor, it may be adhesion in the intestinal wall can attach to each other. There is a passage for in the intestine, but if it's just like this, and this is the adhesion. And then radiation increase, and this is also cause of obstruction. The management is conventional in IV fluid, mesogastric decompression, surgery. In Ayurveda, hing is and castor oil, they are the very effective management of obstruction. Because what happens, if there is a permanent obstruction, surgery is the only way out. But if it is a partial obstruction, but it still allows something to flow, we can increase the rate of that flow by using these things. Otherwise, the surgery is the option. Homeopathy also, the plumbum metallicum 30C, opium 30C, they are the medicine. In yoga, avoid heavy food, number one. Light abdominal massage and abdominal shake also, naturopathy. They are the common method. So in this way, I will introduce you what kind of GI problems a patient faces during the palliative care. It means a person living in old age with chronic diseases. So these are the side effects. Disease is there, but this is also happening. This is not the main disease, but this is the cause of those diseases. In that case, we have to manage the symptom. So Panchkarma therapy, the Virechan is very important. Virechan, Basti and Shirodhara, three things are recommended for these kind of patients. And yogic practices, Pavan Muktasana, Vajrasana, Balasana, and Supta Matsyendasana. The function is also given. They relieve the bloating and gas. And Vajrasana adds digestion, prevents acid reflux. And Balasana, calm abdominal cramp. And the Supta stimulates the digestion. The naturopathy is a warm and cooked meal. No raw food is recommended in the intestinal problem because it will be difficult to digest. Otherwise, we say take the raw salad and all. But in these kind of patients, salad is not good. Cooked food is recommended. Processed and fried food should not be taken. Buttermilk is very good, and with the cumin. Cumin helps in digestion, and buttermilk not having all the gas-making properties of milk. Milk, raw milk and buttermilk, they have a different property. Nutrition point of view, they may be same, but from digestion point of view, they are different. So they have to take. But of course, the buttermilk is added advantage of the biotic. The lactobacillus is there, so it is adding to the probiotic. It adds as a probiotic, maintains your microbiome. Decarbonated drinks like Coca-Cola and these things, Pepsi, should be avoided. Herbal teas, ginger and mint tea should be taken, and excessive dairy products should not be taken because it not get digested. Even a man is not having lactose intolerance, they also face problem if they get more dairy product in their food. Early and light dinner, this is recommended. Late night dinner is not recommended. So herbal remedies, I have So for acid reflux, Isti Madhu, tea, aloe vera juice. For constipation, ghee with warm milk, soaked raisins is good. Munakka is also very good. And for diarrhea, bilb fruit pulp and pomegranate juice, anar ka juice. And for blotting, fennel, saunf, and ajwain water, ajwain ka pani. These are very effective. The end of the life consideration, comfort first approach. We want to give comfort to the patient. Focus on the symptom relief. This is our goal. Skin care, barrier creams to prevent irritation. Because the man is bedridden, the skin is not healthy. That has to be taken. And hydration balance, avoid fluid overload. These things have to be taken care. The take home message is that identify the type of GI symptom. I have shown you 7-8 symptoms. Use integrative therapy, conventional means allopathy plus Ayurveda and other systems. And then dietary modifications, warm, easily digestible food to take. And prioritize patient comfort in palliative care. So I end my talk with this, and there is a case study discussion. A patient with cancer experiencing chronic constipation and nausea. Constipation is also there, nausea is also there. How you will manage? Because cancer patient is going under chemotherapy, he may be bedridden and developing constipation, nausea. How would you manage this case using integrative approach? Think on this and let me know. So what are the key differences between Ayurveda and homeopathy at GI care? Which Panchakarma therapy is best for IBS? What yoga poses is ideal in acid reflux? GERD. These are some questions which you can answer in the Google class. So thank you very much.